Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale area, Scottsdale Paradise Valley area since 1992. So at this day, it makes me in practice over 21 years. Today, I'd like to talk to you about a common question that people ask me when they come to me with regards to questioning about the possibility of having their nose enhanced, to have a rhinoplasty or a nose job. People ask me, what is it that you do differently, Dr. Shapiro, than other plastic surgeons, either in the Scottsdale area or throughout the country? And people often come to me after seeing my before and after photographs that I'm very proud of, and hearing patient reviews that I think patients are uniformly extremely happy with my results. What I do differently, I think, is technically one thing. Also, the way I approach patients is a little bit different. I'll start with the way I approach patients. Oftentimes, or actually every time when a patient comes in, I will talk to them about what it is that they're looking for. I think the days are over, or should be over, that a plastic surgeon tells a patient what they should have done. I think it should be a communication between the patient and the doctor, and I think that we should have a mutual shared aesthetic vision in terms of what we're trying to achieve. When a patient comes in, I show them in front of a mirror what it is that I think that they could benefit from. I also have them show me in the mirror and point out exactly what's bothering them. I then go through some fashion magazines to show what an aesthetically appealing nose looks like, and I show that for different nationalities and ethnicities, and show the common traits that are that have a patient's nose appear attractive on the face. Now, no nose fits everybody's face, so I think it's very important for patients to understand that I like to have them go home, and there's some homework involved, and bring back some photographs to show me what they like, because I can't really tell them what it is that I like, and then that should be performed on their nose. I like to have patients help me understand what it is they're looking for. At the same time, at the consultation, we will go ahead and take photographs, and I image them on a computer to show a patient what it is that I think that I can do for them. At the next visit, before a patient decides to have the rhinoplasty, we'll go ahead and talk about what it is that I can do for them, what it is that they're looking for with regards to pictures that they brought in, and come up with a common vision, like I said. Now, the second thing, aesthetically, when I perform at rhinoplasty, I do almost all of them through an open technique, and that affords me an extreme amount of precision with regards to performing the procedure exactly how it is that we've talked about, and with results that are not surprising to the patient. I'm very proud that my revision rate for rhinoplasties is almost zero, and I attribute that to the fact that I am so technically exact when I perform the rhinoplasty, and I think that comes from attention to detail. I think I've been lucky enough to be born with a pretty good aesthetic sense, and I think that communication that I work so hard to achieve with patients is a framework or a way for me to perform that rhinoplasty, for me going into the procedure knowing what the patient's looking for. After the procedure, some of the most rewarding things that I find are when I take the splint off and the patients are so ecstatic with regards to how they look and how they feel about themselves. The most common thing that I hear from my patients is that other people can't tell exactly what's been done, even family members. Although the before and afters can be quite dramatic, I think the real aesthetic feat here, I think what makes my practice so special is that I can make it look as though it fits someone's face, and that this is the nose they should have been born with. If there's any questions, come into my office for consultation, and I'd love to review what it is that we just talked about. Thank you.